The East Boston Neighborhood Health Center has been a vital part of the community for over 45 years. Now, from the beginning, their services have been defined by the needs of East Boston and the communities they serve. They're the leading health care provider in the area and is among the largest community health centers in the country. Now, of the many successful outreach programs they offer, one of them is Project Shine, which stands for Support Healthcare Intervention and Education for individuals with HIV and AIDS, and also for those at risk. To tell us more about this great program, we've invited its program manager, Elisa. She's brought along the Shine Health educator, Emely Orellana de Bautista, beautiful name, and Shine peer leader, Cristobal Santos, also a beautiful name, so you don't feel jealous. Welcome to Urban Update.
Thank you, Alberto. Thank you so much for having us here. It's a pleasure. So Project Shine, as you mentioned, is a special program of the East Boston Neighborhood Health Center that has been caring for individuals living with HIV/AIDS for over 20 years. The East Boston has done an amazing job at responding to the needs of the community, and this is one of the big needs that existed many, many years ago. And Project Shine is really a one-stop shop for individuals living with HIV/AIDS. We provide an array of services that range from prevention and education, screening, testing for HIV, STDs, and hepatitis, as well as HIV primary care and coordinated services. So pretty much anything that individuals with HIV would need, as well as outreach into the community and making sure that people know their status and have the right information regarding how this infection is transmitted.
What a wonderful guest, right? I didn't even ask a question. She went right into it. I love it. I'm just kidding. I'm just kidding. So here is a question for you. What is a health educator? What is your job over there?
So as a health educator, I do counseling and testing. So anyone who wants to get screened for HIV and some of the other STDs, they would talk to me or one of the other health educators. So we have a good balance of males and females. So we provide basic STD, HIV education, how to prevent it, what the treatment is like, and we do the screening. So we do the blood draws, and we also collect urine for chlamydia and gonorrhea if anyone's interested in getting tested for that. We do go into the community, so we do have some groups, and so we have youth-based groups. So we have the community prevention person who's doing groups at the YMCA right now. We work with some of the sober houses in the area, and we provide education and testing on site for those groups too.
Now, a peer leader, that seems like a very important part of this whole process. Anytime you have the word peer in there, how do you go about your job, and really what is your basic message to those that you are leading?
Well, the first thing that I do is try to connect with every person that comes in, who comes out HIV or not. One of the things is to make them understand that if they are HIV positive or they have AIDS, they could live with this. I've been living with this for more than 30 years, so I understand what it is to be surviving.
Yeah, when they look at you, you look completely healthy. You look better than most of us here.
Over 60 years old.
What?
Yeah.
60?
Yeah.
6-0?
Yeah, 6-0.
Oh, I need to know what you're taking over there at East Boston. That's going to help. Really?
Yeah.
That I did not. That surprised me. Good for you. Good for you. Now I can tell by the last name Santos, Bautista, and Sosa. I can tell that all of you must speak Spanish because part of that community, as we just did the last segment, it's a very mixed community, right?
Yes.
So I would imagine that especially Spanish is very important there, and a lot of the stuff that you do has to be done in different languages, right?
Yeah, so all the health educators speak Spanish as well as English. For the medical case managers, a different component of care, we have at least one case manager speaks Portuguese. So everyone on staff speaks another language.
Yeah, and the center in of itself, East Boston Neighborhood Health Center, has been at the forefront. It's one of the largest, but it's been in the forefront of kind of this cultural outreach and making sure that everybody who goes there feels welcome. We have a picture of the pharmacy on the first floor, but it's a very friendly place to go.
It really is, and I think one of the commitments of the health center is making sure that we're providing services in a culturally competent manner. And so the staff really need to reflect the community that we serve. And this is why we make sure that our staff are either bicultural or speak Spanish or a different language to better meet the needs of the people that we're serving.
How do you guys describe East Boston? Okay, first of all, just Puerto Rico?
Yep.
I knew that.
El Salvador.
I was going to say El Salvador. Sosa, you want me to guess?
You can guess. Go ahead.
El Salvador.
El Salvador. That is it. You're good.
Yeah, guess what am I?
Cuban.
Oh, Cuba, good for you. Good job, good
I
job.
guess it
Yeah,
was-
no, you're right. Yeah, absolutely right. All right, so again, this is the kind of mix that we're talking about East Boston, right? And we have some elderly folks there as well for many, many years. Many of them are Italian Americans. So you guys are right in the middle of America. For those who don't know where you are, tell me where you guys are.
So our program is actually located at 79 Paris as of April. Currently, we're at 20 Maverick.
Okay.
So we're going to be there temporarily until mid-April, and then we move back to 79 Paris. But the health center in general, if they go to 20 Maverick, they can ask for Project Shine, and they would be directed to us.
Or the website, which you
Or the
have it for,
website,
right?
yes.
www.ebnhc.org. There is your new logo. I remember the old logo. This is a pretty new logo, right? And Project Shine is
It
getting a new
is.
logo too?
Yes, we are. We are getting a new logo, yes.
All right, when you
Pretty
guys
soon.
get something going on in the summer or something, you guys can come back here and talk a little bit about it?
That would be great. Yes, we'd love
Come
to.
back, talk a little bit more about PrEP also, which is one of our newer services.
Which one is
we
that?
have. PrEP.
Okay.
So PrEP is an HIV medication that's given to people who do not have HIV but are at risk of contracting HIV.
All right, you and I are going to have a conversation because I want to look that good when I'm 60.
Anytime.
In about 30 years. Do the math. Just kidding. All right, thank you. All right, when we return, a vibrant community for artists, students, and audience members through an incredible school of music featuring a truly legendary listening venue. All the details coming up right here on Urban Update.